All right, all right. I am so excited to have everybody in here today again for our third installment of our Ultimate Back Pain Guide. So it's actually our fourth episode in the series, but the third type of low back pain. So let's take a look. I'm going to shrink myself to the corner. Boom. And so we've got three different types of low back pain that we've discussed this week: muscle strains, joint sprains, disc problems, and today we're going to hit degenerative low back pain. It's usually age-related stuff. So let's take a look. What are signs and symptoms of degenerative back pain problems? Well, it typically affects those that are older. So 65 plus, those that have kind of had wear and tear and gravity work its magic on you. And gravity seems to win every battle that it fights. So these type of folks, they tend to find that sitting feels good, resting feels good. Standing and walking tends to be a little bit more painful. They have difficulty being active because of the pain. It's usually a dull, achy pain that's somewhat constant, and then sharper episodes, depending on what's going on, they can get more sharp, stabby pain as well as the constant aches. This is something that muscle relaxers and narcotics don't really help with very much. And they can prolong the recovery period. So I don't necessarily recommend them. It's also not something that you'd go into the emergency department for typically, unless you're getting a lot of like numbness, tingling in the feet, or your legs are starting to feel weak. And then that's definitely a reason to go seek more immediate help. But otherwise, a physical therapist is the best place to go to receive help, because they're going to be able to determine whether or not you need x-rays or further imaging, or if we can just get started on treatment right away and start interrupting that pain cycle and getting you help right away. And so it is something that won't go away without intervention, and I recommend getting some hands-on treatment as well as some specific exercises that help this type of pain. So let's talk a little bit about the background of what's going on here. So we've got the anatomy of the spine presented here. So we've got the body of the vertebrae there. So each body is kind of the bigger chunk of bone, and then we've got the spine part that has all those funny little angles and projections coming off of it. In between those, we've got those intervertebral discs, and where each joint or where each segment interacts with the next one, we have those facet joints. And those facet joints, what they do is they are designed to help direct the movement of the spine. So some help guide you in flexion forward and extension backward. Some help guide rotation. And so they're designed differently through different parts of the spine to guide different motions. And then within each joint, there's what we call a joint capsule. And that's that little space where where the two bones touch each other. And so there's some cartilage in there as well as fluid. And so what happens typically with degenerative changes is we can get arthritic buildup in each of those joints, which can cause a lot of pain and restriction of movement. We get a lot of problems with the body of the vertebrae collapsing and shrinking down itself. And then the disc height narrowing happens quite a bit. And so those are reasons why we shrink as we get older, where we're not quite as tall. It's those body of the vertebrae and those intervertebral discs that collapse, and we can lose a couple of inches. And so what happens when that happens is, see that white space in between the spiny part and the body of the vertebrae? That white space is where the nerves come out from the spinal cord. And so if the body and the intervertebral discs shrink, so does that white space, and there's just less room for the nerves to come out. And so we can get a lot of pinching of the nerves and other problems. And so that's kind of the background of the anatomy of what causes this degenerative joint pain. So what do we do about it? Well, we want to decrease pain, we want to restore normal function, and we want to eliminate the pain forever. So those are our main goals of treating this type of pain, so that we can get rid of it forever. And so how do we do that? Let's decrease pain. We're going to do that with heat or ice. It doesn't really matter for this one, whatever feels best for you, because it's not as much of an active problem. It's not an inflammatory process necessarily as much. And so heat or ice, whatever helps you feel best. Anti-inflammatories, they can help kind of minimize symptoms, but aren't necessarily always necessary on a day in, day out basis. And so check with your physician about what is kind of the best medication regimen for managing this long term. Massage or vibration can help, again, interrupt that pain cycle when you get acute cases of it being more flared up. Electrical stimulation or TENS helps as well. Really what you need to do though is go get help from a physical therapist right away so that you can interrupt that pain cycle and start learning what you need to do to help your pain specifically. There are many things we can do. We can do spinal decompression, um, uh, and that helps some people, not everybody, and only if that's safe for you. Osteoporosis, previous back surgeries, other things can make that so it doesn't really work for you very well as inner ear balance things. So sometimes we don't recommend that for everybody. Occasionally, we'll send people back to a physiatrist or to their doctor to get occasional injections in those facet joints or other things like that to help decrease irritation there. Really, my favorite way of treating it is with directional preference movements. So moving in a specific way that helps decrease that pain. And so we play around with that a bit to find out what's going to help you the most. Here are my top 3 that tend to help most people. Forward flexion, just bending forward in the chair, touching your toes and coming back up. Repeat that about 10 or 20 times. And that tends to be really helpful at decreasing people's pain and helping them feel better. Next is the single knees to chest. I'd try that first and just see how well your back tolerates that, and then you can move to the double knees to chest. But those are stretches where you kind of stretch and hold. Keep it gentle. Don't do anything too aggressive. But stretching multiple times a day, 6, 7, 8 times a day even, isn't too much to help keep that pain at bay and help keep you being able to move. And so that can be a really helpful set of exercises to do to keep moving. And that's the next phase of things, is we want to keep everything moving so that we can maintain that normal function. And so we want to move in pain-free ways that help us increase our mobility. We want to do lots and lots of gentle stretching, and we want to keep exercising. You've got to push yourself a little bit. It's going to be painful at first to exercise, and so just know that that's going to be part of it. But if you can push past that early phase of it being uncomfortable, you're really going to get a lot of relief in the end as you get in better shape. And so really focus on keeping that active and moving and exercise. So we also want to focus on proper posture. It's going to help decrease and minimize the amount of future arthritic gain and changes by making sure that we're using those bones and joints properly. And then we want to get specific help, hands-on work to help free up each segment and make sure that they're moving properly, and make sure that that spine is working as well as it can with the changes. And so that's something where I'd get some hands-on help to be able to manage that. So eliminating the true cause of your pain with degenerative type of low back pain, that's a little bit more difficult simply because we can't eliminate the disc height narrowing or the degenerative changes in the facet joints, that arthritis. The key though is to stay active. We actually get more degeneration and more problems by not moving. Sitting in a chair actually causes arthritis more than movement. And I know runners or other people that are active get a lot of flack about, oh, you're going to have arthritis later. Actually, runners and cyclists have less arthritis than non-runners. And the reason why is they keep their joints healthy by moving them and stirring things up so that they're always having to repair. And they actually avoid a lot of that arthritic buildup. When we sit for long periods of time, it actually builds that arthritis up more and causes more wear and tear. Body weight is a factor in that. If we gain more weight, it puts a lot more stress and pressure with every movement that we make. And so it just wears out that cartilage so much faster. And so decreasing body weight is a huge way that we can reduce this pain. As we lose weight, we'll feel so much less pressure and a lot less pain in our joints. Focusing on posture, again, big key for avoiding future degeneration. And then a big key is move every hour. You want to keep moving all the time so that you don't cause more buildup. All right, so those are our 3 main ways of eliminating low back pain. Interrupt the pain cycle and then start working on moving better. So here's my big tip for avoiding pain. It's avoid pain. So avoid things that make your pain worse. So be careful with high-risk activities, weigh dynamic things. Be careful with heavy loads of lifting and other things that increase your risk of getting arthritic changes, disc height narrowing, other things like that. The other thing is being in pain causes more pain. So we get caught in a reflex cycle where the pain causes muscles to tighten, they get angry, and causes more pain. And so we've got to interrupt that cycle. Otherwise, we're going to just get stuck there, and it'll take longer and be harder to get out of that. So the minute you have pain, you should start doing stuff to get rid of it right away. Don't wait and see, I think I'll see how this goes, if it'll resolve on its own. Go get help right away and make sure we can eliminate that pain so it's not a problem for you. The other thing is know the difference between good and bad pain. And that sounds a little silly, but good pain is anything that I can do and it hurts because I already have this arthritis. It's going to hurt. But if I can do an activity, say cycling or elliptical or treadmill, and or walking around the neighborhood, and it stays at a 3 out of 10, I have 3 out of 10 pain and it stays there as I exercise, I'm totally okay with that. What I don't want is if it starts to get up to a 4, 5, 6, then we need to stop that activity. If it starts getting worse, that's bad pain. And so we want to stop that activity and modify it, do something else. Don't stop activity altogether, just stop that activity and do something else that's less painful and that you can tolerate. So there it is. My big tips for avoiding pain, for getting rid of this degenerative type of low back pain. So the week will roll on. On Monday, we're going to do a recap of all 3 days of pain and how to eliminate those. So we're going to do a recap. We're going to bundle it all up and give it to you. And then we're going to do a live Q&A where you can ask any questions you might still have, where you can, chat with me during a Facebook Live, and we can figure out a little bit more about your low back pain and what you need to do about it to get help. All right. Hopefully this all made sense to you. If it did, just comment down below. Yeah, it makes sense. Got it. If it didn't make sense, though, go ahead and drop any questions you might have down below, or just comment, I have questions, and I will make sure to direct message you, and we can kind of have a private conversation about your questions. I want to just say thank you so much. Feel free to contact us anytime here at Body Smart. Happy to help in any way that we can. But thank you so much for joining us this week in talking about all 3 different types of low back pain. It's been my pleasure. I want to help people out in any way that I can. And so I thought, let's get this information out to as many people as we can. And so that's why we did this week. It's been awesome. Thanks so much, and have a wonderful rest of your evening.